And so without further ado, I am going to turn it over to Kelsey Alexander from the Connecticut Alliance to End Sexual Violence. They are going to share today on a new approach supporting partnerships between sexual assault crisis centers and local health departments. Welcome, Kelsey.
Thank you, Jen. Hi, everyone. So as Jen just said, I'm joining you all from the Connecticut Alliance to End Sexual Violence, which is Connecticut's state coalition of sexual assault crisis centers. And I'm going to, for the next 10 minutes, tell you about a project we've been working on for the last year and a half with our RPE funding, which is about supporting partnerships between the sexual assault crisis centers in Connecticut and their local health departments. All right, so this is a bit of an overview of how we envisioned this project and why we prioritized this kind of work with our RPE funding. The real goal is to build some capacity for folks in Connecticut who are either already working on sexual violence as a problem, the folks at the sexual assault crisis centers doing prevention work, response work, all the wonderful things that they are doing. And then some folks who could be tasked with working on preventing sexual violence or addressing sexual violence in some way, folks working in the public health field or sphere, to build some capacity for folks understanding sexual violence as a public health problem. Probably many of us who are here today, we use that sentence or like that language all the time, that sexual violence is a public health problem. But I'm not sure how many folks at local health departments would say that or really know what that means or know how to address sexual violence really confidently, at least in Connecticut. And how many folks from our sexual assault crisis centers also understand what that means and think about prevention from a public health point of view, right? So that's sort of where we were coming from, that we wanted to just infuse more like public health lens and use of data and use of effective prevention and partnership building into some of the work that's happening in Connecticut. So you can see some of the objectives below. The real crux of this is just building partnerships between sexual assault crisis centers and local health departments. And then we also have some goals around increasing folks' knowledge, as well as developing some tools to support these partnerships. I'll show you a little bit of that later. So this is how we approached this new project. We gave an overview of this project to folks from the sexual assault crisis centers in the state. Each member center identified one person to take on this work. And I met with everybody monthly. We did skill building in our monthly meetings. Some of the skills that we went over or tried to build in these spaces were how to frame sexual violence as a public health issue. Like, if that's how you're going to try to talk about this problem, what kinds of things do you need to be able to talk about? Like data, like how sexual violence is connected to other health issues, things like shared risk and protective factors. We provided a bunch of tools, and along the bottom there, those logos, and that's not a comprehensive list, but those are some other organizations that I consulted with to either just pull tools that they already had on their website, or to meet with folks and hear about how they had done some work with public health and the anti-violence field, and share as many resources as possible with people working for the sexual assault crisis centers to try to help build their confidence and capacity to have these kinds of conversations and do this outreach. We offered 3 more formal training workshops for everybody involved. So that's the crisis centers as well as their health department partners. We talked about using shared risk and protective factors as an effective way to do prevention work. We had a training on building effective partnerships, and then we did one on action planning and what does it mean to develop an action plan with a new partner. I'm going through this quickly. We'll talk more in depth if you come to my breakout room. So here's sort of the array of outcomes that we have at this point. So we're about a year and a half into this project. So here on the left, these are some of the outcomes I could say where folks felt a little frustrated or felt that they didn't really make a ton of progress with this. Either they may have done a lot of outreach and just not really gotten a lot of response from the health departments that they were doing the outreach to, or made some progress. This is sort of true of both these two boxes right here, like made some progress and then either found out that the staff member from the health department they're working with really doesn't have capacity to be meeting with them regularly or developing a more meaningful partnership, or the person may have just left. We saw both for the health departments and for sexual assault crisis centers, just a lot of turnover, which can obviously affect the momentum of a project like this. Then some more positive or some outcomes where we saw a little bit more progress towards working together. We have one sexual assault crisis center who has developed a really strong relationship with one of their local health departments, and they have shared an action plan where they're going to be doing some training for barbers and stylists in that region on how to respond to disclosures of sexual violence when they're working with they're cutting someone's hair, which is I think a really cool audience to be reaching. And the reason they're able to reach that audience is because the local health department does the licensing for barbershops and salons. So that's probably a project that would not be happening if this partnership didn't exist. I have this highlighted in yellow because to me, this is less of a prevention type project. It's more response or intervention, right? But I'm hopeful that they will get to a place of doing more prevention work together. And then some really cool outcomes around doing some programming together for parents to be preventing child sexual abuse. I'm going to talk a little bit more about this one on my next slide, but another crisis center and health department who have a really strong relationship and are just very consistently identifying opportunities where, you know what, we really should have the Rowan Center's perspective on this issue that we are in meetings about, or we should be bringing people in from the health department to weigh in on this issue, just really consistently keeping each other in mind and bringing each other to meetings in different spaces. So that's who I'm talking about with this slide. The Rowan Center is a sexual assault crisis center based in Stamford, Connecticut, which is like the little tail of Connecticut that's very close to New York City. They partnered with the Norwalk and Stamford health departments, and a few other outcomes that have come from this really strong, even though it's still fairly new, but really strong partnership. The Rowan Center was invited to monthly MPOX check-ins when these were happening a while ago, which gave them an opportunity to ask about vaccine availability for survivors of sexual violence, which was not something that the folks that were doing vaccine distribution and writing up like what the circumstances need to be for somebody to get access to an MPOX vaccine. We're not really thinking about folks who might be at the hospital for an accompaniment, having been recently sexually assaulted. So that conversation was able to happen. There has also been ongoing work addressing trafficking in the area. And a project that I'm really excited about is they're working towards a bystander intervention campaign or training for some bars in the area, because they're noticing a trend of people experiencing sexual harassment, sexual assault in some of the bars in this region. And so the Rowan Center has asked their health department partners to weigh in on a campaign around that. I'll give more information about all of this in the breakout rooms. So here's a few things we have learned so far. I would say in general, thinking about sexual violence as a public health issue still feels like a really new idea, topic, concept to both folks working at sexual assault crisis centers and people working at their local health department. Obviously, folks coming from a local health department understand public health and have that kind of expertise, but it felt, I think, a little bit out of scope or just was not presented to people prior to these partnerships that sexual violence is something that you could be addressing from your local health department from a community education or a data collection perspective, or developing campaigns. That felt like a really new idea to a lot of folks. Local health departments are really important partners and have very limited capacity. That has emerged over and over again, that there's been staff turnover, or people have really specific funding to address really specific health issues. So we've tried to address, again, shared risk and protective factors. And so maybe we can find a way to work sexual violence into the projects you're already doing. Or how does sexual violence connect to some of these other health issues like suicide or STI prevention or mental health, but just really limited capacity. I'm going to talk more about partnership building in the breakout room, but we've found that as a strategy is underutilized as a prevention tool. And just the need to identify both champions within the health department who are going to really spearhead this work and keep it moving forward, but also within our state health department to find people who are really connected to the local health department to help message this project correctly and make sure that they're hearing it from leadership as well. This is my last thing. I know I'm right at time. So our resource development and some next steps. These are some examples on the right of resources that myself and folks at the Alliance developed to try to support these partnerships. There's a toolkit and then some more 2-pager sort of fact sheet documents. I'm happy to share these with anybody. I'll put my email in the chat. We have some evaluation findings that are forthcoming from this project. And we are hoping in the future to begin working with community health workers because we see them as really crucial partners in this work as well. I'll put my contact in the chat, but let me know if you have any questions and come to my breakout room.